Today we're talking about urinary tract infections, or UTIs. Nearly half of all women will experience a UTI at least once in their lifetime. But it's not just women. Men, children, and even babies can get UTIs too. UTIs happen when bacteria enter the urinary tract through the urethra and cause an infection. Symptoms include a burning sensation when you pee, feeling like you constantly have to go, and overall discomfort. There are effective remedies you can try at home to relieve symptoms and prevent UTIs from recurring. Let's get started. Let's talk about the first sign of a UTI: pain or a burning sensation while urinating. This uncomfortable symptom is one of the earliest and most common signs of a UTI. When bacteria irritate the lining of your urinary tract, it causes inflammation. That inflammation leads to the burning, stinging feeling, especially when urine passes through the urethra. It's your body's way of saying, hey, something's not right down there. While this symptom is common with UTIs, it can also be a sign of other conditions. Feeling a burning sensation and constantly needing to pee, even if just a few drops come out, this can be incredibly frustrating and uncomfortable. This frequent urge to urinate is another sign of a UTI. Urinary tract infections are common, especially among women, and can cause a range of symptoms. When bacteria invade your bladder, they irritate its lining, making it feel constantly full. This irritation can lead to a persistent feeling of needing to go, even when your bladder isn't actually full. This sends signals to your brain saying, time to go, even when there's not much to empty. It's like a false alarm that keeps going off, disrupting your day. This urge can be super disruptive, making it hard to concentrate on work or sleep through the night. Imagine trying to focus on a meeting or enjoy a meal, only to be interrupted by the need to rush to the bathroom. Holding it in is not the answer. It can worsen the infection. Ignoring the urge can lead to more severe symptoms and complications. The frequent urge to pee can also be caused by other conditions, like an overactive bladder. This condition can be managed with lifestyle changes and medication. If you're experiencing this along with other UTI symptoms, it's time to pay attention. Consult a healthcare professional to get the right diagnosis and treatment. Don't let this issue control your life. Take action and find relief. Let's talk about the appearance and smell of your pee. Changes in your urine can indicate a UTI. Cloudy or murky urine, almost like apple juice, or a strong foul odor can be signs of a UTI. The cloudiness is often caused by a buildup of white blood cells fighting the infection. The strong odor is due to waste products produced by the bacteria. While these changes can indicate a UTI, other factors like dehydration or certain foods can also play a role. Always consider all your symptoms together. If you notice these changes, it's worth paying attention. Blood in your urine or hematuria is a more serious symptom that warrants attention. It can be alarming to see blood in your urine, but understanding the potential causes can help you take the right steps. While not as common, it can occur with UTIs and should never be ignored. Hematuria can be a sign of various underlying conditions, some of which may require prompt medical attention. Sometimes it can be a sign of a minor issue, like a UTI, that can be easily treated. UTIs are infections that affect the urinary tract and can cause irritation and inflammation. When the lining of your urinary tract gets irritated and inflamed, it can become fragile and prone to bleeding. This can lead to the presence of blood in your urine, which may appear pink, red, or even brownish. This bleeding can cause your urine to appear pink, red, or brownish. The color and amount of blood can vary, but any visible blood should be taken seriously. Regardless of the amount, it's essential to contact your doctor to determine the cause and get appropriate treatment. Your healthcare provider can perform tests to identify the source of the bleeding and recommend the best course of action. Don't ignore this symptom. Get it checked out. Early diagnosis and treatment can prevent potential complications and ensure your health and well-being. Another uncomfortable symptom of a UTI is pelvic pain or pressure. This is more common in women, but can occur in men too. It's like a dull ache or a feeling of fullness in your lower abdomen or pelvic region. When UTI-causing bacteria move in, they cause inflammation and irritation. For women, the pain might be centered in the lower abdomen or radiate to the lower back. Men might feel discomfort in the rectum or lower abdomen. If you're experiencing this symptom, especially if it's severe, get it checked out by a doctor. Fever and chills are more serious signs that the infection has spread to the kidneys, a condition called pyelonephritis. When bacteria invade your bladder, your immune system sends out white blood cells to fight them off. But sometimes, bacteria manage to slip past the defenses and reach the kidneys. This triggers a more intense immune response, leading to fever and chills. Along with fever and chills, You might also experience lower back pain, nausea, and vomiting. If you're experiencing these symptoms, seek medical attention immediately. Kidney infections are serious and require prompt treatment. Now that we've covered the symptoms, let's dive into some home remedies. First, drink plenty of water. Staying hydrated helps flush bacteria out of your system. Aim to drink at least 8 to 10 glasses of water throughout the day. Not a fan of plain water? Try herbal teas, broth, or water infused with fruits and vegetables. Staying hydrated is one of the simplest yet most effective ways to support your body's natural defenses against UTIs. So, grab that water bottle and start sipping your way to a healthier urinary tract. It's an easy and effective remedy. Let's talk about cranberry juice. There's some evidence that cranberries can help prevent UTIs. Cranberries contain proanthocyanidins, which may help prevent bacteria from sticking to the walls of your urinary tract. Think of it like a lubricant, making it harder for bacteria to grab hold. Most studies focus on cranberry juice's preventative effects, not its ability to treat an existing UTI. Sipping on cranberry juice might help reduce your risk of future infections. If you don't like the taste, you can opt for cranberry supplements. Choose a reputable brand and follow the recommended dosage instructions. A healthy gut plays a crucial role in preventing UTIs, and that's where probiotics come in. Probiotics help maintain a balanced and healthy gut microbiome. When good bacteria thrive, they keep bad bacteria in check, preventing them from causing trouble. Certain strains of probiotics like lactobacillus inhibit the growth of harmful bacteria in the urinary tract. You can incorporate probiotics into your diet through fermented foods like yogurt, kefir, sauerkraut, and kimchi. Or you can opt for probiotic supplements. Choose a reputable brand and follow the recommended dosage instructions. Finally, let's talk about D-Mannose, a lesser-known but potentially powerful ally against UTIs. This simple sugar, found naturally in various fruits, has been gaining attention for its potential health benefits, particularly in urinary tract health. D-Mannose is a type of sugar that occurs naturally in some fruits and is available as a supplement. You can find it in cranberries, apples, and even oranges. It's fascinating how something so simple can have such a significant impact on our health. It works by coating the fimbrial of E. coli bacteria, making it harder for them to stick to the walls of your urinary tract. Imagine it as a protective barrier that prevents these harmful bacteria from latching on and causing infections. This allows the bacteria to be flushed out more easily when you urinate. Drinking plenty of water can help in this process, ensuring that the bacteria are washed away from your system. Some studies show promising results for D-Mannose in preventing UTIs, especially in people with recurrent infections. It's encouraging to see scientific research backing up what many have experienced firsthand. If you're considering trying D-Mannose, talk to your doctor to determine the appropriate dosage. It's always best to consult a healthcare professional before starting any new supplement to ensure it fits well with your overall health plan. Ensure it's safe for you. Incorporating D-Mannose into your routine could be a simple yet effective way to support your urinary tract health, but always prioritize safety and professional guidance. So, there you have it. Your comprehensive guide to understanding, preventing, and finding relief from UTIs. UTIs are common but treatable, and many people find relief with simple home remedies. Staying hydrated, practicing good hygiene, and incorporating natural treatments like cranberry, probiotics, and D-Mannose can make a difference. If you're experiencing severe symptoms, or if your symptoms persist, consult a healthcare professional. By taking proactive steps and listening to your body, you can reduce your risk of UTIs and maintain a healthy urinary system. Until next time, stay healthy, everyone.